analyze. Analyzing now. Stand clear. Shock advised. Stand clear. Push to shock. Start CPR.
So what you're seeing now is a defibrillator that was used off of one of the units. This is the standard setting that's applied across the hospital. And you'll notice that it has a metronome on there. It also has a countdown clock for the 2 minutes. So some of the things that we've been hearing as far as feedback is that we are struggling to hear the sound of the metronome as it's currently set. The other thing is that the current setting has a voice prompt of when to ventilate. It doesn't always match up, unfortunately, though, because if you don't start it exactly at the same time as the timer on the AED, then it creates some confusion in the room about the count of 32 for a patient that does not have advanced airway.
Ventilate.
Our recommendation would be to go in and make changes house-wide on the default settings to match what we are about to show you on the education AED. And that is to increase the volume to max capacity so that you can hear the metronome. Also to remove the voice prompts to ventilate the patient. You'll still be able to visualize a clock on the screen of the AED as a guide, but it won't verbally prompt you for those things so that it doesn't create that confusion if the person that was sorting the code needs to alter the timing. So now we are looking at the life pack
Analyze.
that is assigned to the education department. You'll notice it's much louder, and then it also does not have the voice prompts for providing ventilation.
Analyzing now. Stand clear. Shock advised. Stand clear. Push to shock. Start CPR.
So it's going to do continuous metronome with no voice prompts for the full 2 minutes, which is the basic change that we're trying to implement to prevent confusion in a code scenario.
Push analyze.